When world leaders gathered at United Nations headquarters in September 2011, it was only the second time that a health issue, non-communicable diseases, or NCDs, was the subject of a high-level UN meeting. The impact of NCDs, primarily cardiovascular disease, cancer, chronic lung disease, and diabetes, is immense. It is projected that by 2030, NCDs will account for more than 75% of deaths worldwide. Tobacco use is the single greatest preventable cause of NCDs. Prior to the high-level meeting, also known as the NCD Summit, global health experts declared tobacco control an urgent priority in the fight against NCDs. World Health Organization Director General Margaret Chan labeled tobacco control one of the best buy strategies for tackling the epidemic. As the summit opened, Dr. Chan reminded leaders of the devastating impact of NCDs and of the powerful tool at their disposal to tackle these diseases, the WHO Framework Convention on Tobacco Control. She also urged the international community to stand firm against the vicious attacks of the tobacco industry.
For all these reasons, non-communicable diseases deliver a two-punch blow to development. They cause billions of dollars in losses of national income, and they push millions of people below the poverty line each and every year. Excellencies, ladies and gentlemen, these diseases break the bank, and they are largely preventable through cost-effective measures. Some have an especially big payback. For example, full implementation of the World Health Organization's Framework Convention on Tobacco Control would bring the single biggest blow to heart disease, cancers, diabetes, and respiratory disease. I call on heads of states and governments to stand rock hard against the despicable efforts of the tobacco industry to subvert this treaty. We must stand firm against their open and extremely aggressive tactics against some governments.
Later, Australian Health Minister Nicola Roxon described the industry's attack against her country's plain packaging campaign, noting that Australia is not the industry's only target. Recognizing the important support provided to her government by the Framework Convention on Tobacco Control, she pledged a financial contribution to the convention's secretariat.
We're not alone in this. I know our friends in Uruguay, in the US, in the United Kingdom, in Norway are also facing challenges for the steps that they're taking, and we want to welcome the leadership of those countries and encourage others to not bow to the pressures from the tobacco industry. In the short time I see the warning bell going, I just want to also say we have found the work from the WHO on the Framework Convention of Tobacco Control absolutely vital in taking this step. And for that reason, Australia is today announcing that we will provide a further $700,000 to the Secretariat to support the global implementation of the Framework Convention on Tobacco Control.
European Union Commissioner for Health and Consumer Policy, John Daly, also announced a contribution to the Convention Secretariat as he described steps taken to revise the EU's Tobacco Products Directive.
As regards tobacco, I am determined not to let my fellow Europeans watch and do nothing while our young people are smoking away their health and their future. This is why the European Commission is currently working on a proposal to revise the European Union Tobacco Products Law to strengthen health warnings and make tobacco products less attractive in all possible ways. The European Union has also ratified the Framework Convention on Tobacco Control and is committed to its implementation. We will further contribute to this process in developing countries by providing additional funds to the Convention Secretariat.
Political commitment to the Convention should be the meeting's priority, said Mohammed Wahid, Vice President of the Maldives.
The top priority of this UN high-level summit on non-communicable diseases should be in strengthening political resolve for the accelerated implementation of all aspects of the Framework Convention on Tobacco Control and other methods needed to achieve a world essentially free of tobacco.
As a party to the convention, Nigeria has passed a national tobacco control bill and developed a national policy on NCDs. Minister for Health Onyebuchi Chukwu told the summit.
And so Nigeria, realizing the threat of NCDs, have decided to take major steps to respond to this epidemic. We have developed a national policy on NCDs. We have also banned advertisements and use of tobacco products in public places since 1990. Our federal capital, Abuja, has led the way and is a tobacco-free city. We have also signed and ratified the WHO Framework Convention on Tobacco Control. The process of domestication of the WHO treaty is ongoing, and the National Assembly has recently passed the National Tobacco Control Bill.
Barbados has also implemented strong tobacco control measures, according to Minister for Health, Donville Innes.
Barbados set about 2 years ago to prohibit the sale of tobacco products to minors. There's no sense saying that tobacco is one of the major factors related to NCDs and not do anything about it in a strong and decisive manner. Barbados also, 2 years ago, banned smoking in public places. We recognize that many of our workers were challenged with secondhand smoke, and we took the bold political decision to ban smoking in public places, and I must say that despite initial hue and cry, this has also gone down well.
Later, WHO Director General Margaret Chan again stressed the importance of tobacco control, explaining to world leaders the most effective measure they could take to reduce demand for tobacco.
In terms of demand reduction, ladies and gentlemen, increases in tobacco taxes and prices are the most effective measure. They not only protect health, they bring a considerable revenue to your government. And the same is true for taxes on alcohol.
Marty M. Natalegawa, Minister for Foreign Affairs of Indonesia, who spoke on behalf of ASEAN, said that countries in his region are considering using tobacco tax revenues to finance the fight against NCDs.
Second, we are strengthening our national health policies and accelerating programs for tobacco control. We will not be content only with passing laws that heavily tax cigarettes. We will also consider using the revenues derived from sin taxes to support NCDs prevention. We will continue to promote a smoke-free environment in order to protect our people from secondary smoke.
As the summit came to a close, New York City Mayor Michael Bloomberg encouraged world leaders to act globally and locally by describing the impact of his city's tobacco control measures.
Before 2002, the proportion of adult smokers in our city has been constant for many years, roughly 22%. Today, that has dropped to 14%, the lowest on record. There are now some 450,000 fewer adult smokers in our city than there were in 2002. That means we've already saved at least 1,500 lives a year. Most encouraging of all, the proportion of public high school students who smoke has been cut by more than half, from 18% to just 7%, and that will save even more lives in the years ahead. Such results can be and must be replicated worldwide, because when it comes to preventing tobacco-related illnesses and death, we are in a race with time, a race we can't afford to lose.
It is so decided.
The political declaration issued at the summit reflected world leaders' support for tobacco control, including the WHO Framework Convention on Tobacco Control. The declaration calls for accelerated implementation of the convention, urges countries that have not already to become parties, and notes the important role that tobacco taxes can play in reducing tobacco use and reducing the devastation caused by NCDs. The political declaration also reiterates Article 5.3 of the FCTC, which recognizes that the aims of the tobacco industry are incompatible with public health, and it highlights the important role played by tobacco control in development. The Framework Convention Alliance is working to see that role strengthened at the global and country levels and at the FCTC Conference of the Parties.